so we're going to be doing an oral facial examination, and we're just going to be checking structural and functional movements in your face and inside your mouth to check for speech sound disorder, anything that can cause that. So I'm going to go ahead and put gloves on, and my hands are clean, just putting gloves on for your safety and mine. All right, and we're gonna sit at this height just so I can get a good look for you, okay? So here we go. Well, first we're gonna go ahead and check the symmetry of your face and your lips. And everything seems to be symmetrical. There's no drooping. Everything looks normal, and I'm not seeing anything that would be like a neurological disorder or issue. And then I'm gonna go and have you move your jaw from side to side. Try to not to move your lips too much when you do it. That, good. And it's good there. And go ahead and do it again for me. All right, good association with the lips and the jaw. And now I'm gonna just have you come a little bit forward for me and open and close your mouth. Close. Good. All right. No, there's not any popping or grinding, so that's a good indication of not having any TMJ. So now I'm just gonna have you follow my hand, and we're gonna be checking just to open and close. Follow my hand. Go. Oh. Good, nice gradation. Okay, I'm just gonna use this tongue depressor and check the inside of your mouth. Right, patient has all of their teeth. There's no overbite that I'm noticing, and molars are aligned. Okay, now I'm just gonna have you pucker up your lips and go ooh. Ooh. And then E. E. Ooh-wee. 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 Very good. Everything looks normal, and I'm not seeing any drooping. Everything looks symmetrical in movement. All right, and so now I'm just gonna have you puff up your cheeks and hold the air in, and I'm just gonna check to make sure there's no nasal air leakage. So, right, no air coming out, and release. And I'm gonna check it with the mirror. No puff up, good. All right, nice, very, very good. All right, and I'm just gonna check the lip strength. Good, and when you were doing the air, there was no drooling, so that's very good. Open your mouth and stick your tongue out. Go ah. Ah. Right, and the color looks very good, nice and pink, and I'm not seeing any uncontrolled movement, jerking, or vacillations. Okay, and the tongue did have a good posture as well. Just go ahead and stick it out one more time for me. All right, nice, not too small, not too large. Now we're gonna go and move on to your frenulum, so go ahead and stick your tongue out and move it upwards. Good. And the frenulum does not look too short, so you have a nice good range of motion with that. And now just go ahead and stick your tongue straight out without resting on your lips, kind of curl it. So I'm gonna have you stick your tongue straight out and push up against the depressor. Good, right to the left, good, and to the right. Nice strong movement. And here we're gonna go ahead and have you go la, la, and then say ka, ka, laka, 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 laka. All right, and go ahead and do it again. Laka, 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 laka. Nice anterior and posterior movement of the tongue. Now I'm just gonna have you stick your tongue out and suck it, or bring it back in really quickly. Like that, good. I'll repeat it one more time. Right, and what we're gonna go ahead and move on checking the side to side movement of the tongue. So just move your tongue side to side really fast. Good. And now we're going to check the pharynx. Stick out your tongue. I'm going to use this flashlight and tongue depressor. Get a new depressor for you. And stick your tongue out. Right. And just checking the pharynx and the oropharynx. And move your tongue from side to side. Good, nice color. And just go ahead and stick your tongue out again and check your good job. And tonsils look good. They're not swollen. And now I'm going to be checking the color of your upper palate, the alveolar ridge. Everything looks normal. And I'm just going to be checking the gag reflex. So go ahead and open and placing the depressor in the middle. Good reflex. All right, now I'm going to check the soft palate. So go ahead and say ah, ah, ah. Good. All right, so go ahead and go open your mouth and say ah, and I'm going to check the uvula. Make sure it's not deviating. Ah, ah. Very good. All right, I'm just going to have you open your mouth. I'm going to listen for hypo or hypernasality. Right, and I'm not hearing anything that would indicate poor velar-pharyngeal closure. All right, so our assessment is all finished. Thank you. Completed my first orofacial examination, and after the evaluation, everything appeared to be normal with the patient. They had a strong tongue and jaw and teeth movement. Their lips appeared to be symmetrical. There wasn't any neurological or drooping or drooling issues that I've noticed. Patient was able to follow the directions that I gave them with protruding and retracting the tongue, and they had a normal evaluation of the hard and soft palate, pharynx, and overall I think the evaluation went well and everything appears to be normal.